The Health Insurance Portability and Accountability Act, also known as HIPAA, was passed in 1996. It was made to simplify healthcare administration, prevent fraud, and protect patients' private medical information. A violation of this act means that you fail to comply with HIPAA privacy, security, and/or breach notification rules. In practice, a HIPAA violation can be relatively simple, such as an employee leaving a file containing PHI on their desk while getting a cup of coffee. Hi everyone, I'm Elia from eTactics, and today I'm going to talk about some common HIPAA violations to avoid. Before we get started, make sure that you subscribe to our YouTube channel by clicking the button below. Also, hit that alert bell icon so that when we post new helpful content, you get notified. 1. Looking at healthcare records without permission or authorization. Make sure that patient records containing personal identification are only accessed for treatment, payment, consultation, or legal purposes. 2. Not conducting an organization-wide risk analysis. Conducting regular HIPAA risk assessments can help you avoid future breaches. You should make sure to find where PHI is vulnerable so that the wrong people don't get their hands on it. 3. Failure to address security risks. It's one thing to conduct an audit. It's another thing to do something about the results. Prioritize addressing any risks that are identified during the audits. 4. Denying patient health access to their records. Doing this is kinda illegal and can lead to multiple HIPAA violations for each day the file is denied. Provide people with access to their medical records upon request and without delay. 5. Failure to enter into a HIPAA-compliant business associate agreement. What a mouthful, am I right? A healthcare provider needs to comply with HIPAA, but so do all the companies that work with the provider. Any third-party vendors with access to PHI must also observe HIPAA compliance. 6. Insufficient PHI access control measures. HIPAA laws mandate that you must protect digital PHI at every point of access. Make sure that the authorized individuals are the only people who can access the electronic protected health information. 7. Failing to use encryption or equivalent security to safeguard PHI. Encryption is not mandatory under HIPAA, even if it is beneficial for healthcare organizations. However, equally suitable security measures must protect PHI. 8. Exceeding the 60-day deadline for breach notifications. If your organization discovers a breach, you would normally need to identify those in writing within 60 days. Some states are passing laws to make the deadline as low as 30 days. Make sure to verify local laws. 9. Unauthorized PHI disclosures. Obviously, you don't want to do this because it is a blatant HIPAA violation. If patients don't consent to have their information shared, you can't disclose the PHI. Patients must authorize any sharing of their PHI. 10. Improperly disposing of PHI. What do you do when you no longer need the protected health information? HIPAA has clear laws about how practice needs to dispose of health data. You must securely and permanently destroy PHI when it's no longer needed. If you'd like to learn more about HIPAA compliance and how to avoid HIPAA violations, reach out to eTactics. And you've already made it this far into the video, so you might as well like it, share it, and comment below. What are you waiting for? Subscribe to our YouTube channel.